Okay, Dr. Don Buford here at Texas Orthobiologics, and we're here with one of our patients who had a shoulder problem that we helped him with some injections. He had about a 25 to 30% tear in his rotator cuff tendon on the right, and we talked about all the different surgical, non-surgical options that were appropriate, and we settled on doing PRP injections, and we do that in a certain way. Number one, it's a high-dose injection. Number two, we inject into the joint, a little bit into the tendon, and then into the subacromial space for the amount of tear that he had. And here we are right at 5 months out, and I'm going to have him tell us in his own words how he's doing. So tell me where you were before and what percentage better you are, and show us your motion.
When it first started, I couldn't sleep on it, couldn't get comfortable. And after the shot, about the third month, it got about 50% better, and now it's pretty much 90% better. I can move it in all directions. Like I said, it's about 90% better. So
Great. So for you, it was a good choice.
yes, yeah.
Okay. Thank you very much.